it's a really invasive procedure. It's not dignified by any means, especially if you have, elderly patients that are quite small, they have brittle bones, not to be too graphic, but you can break people's chest bones. It's not nice.
I once told you that story, didn't I? That this is some years ago. I was in sort of the nearest city towards Derby, and I was out shopping on my own, and I went around this corner, and anyone who knows Derby, St Peter Street, and so kind of main shopping street, pedestrian area, and there was a chap that had collapsed on the floor. I didn't know him obviously, and there was just kind of people standing round, and I'd been to a record shop, CDs at the time. I'm now a vinyl snob, aren't I, Rachel? But it was CDs at the time. And I'd had them in a bag, I think it'd be HMV. Had them on the... So I went down and see what was happening. And I had to kind of... people just kind of, I don't know if they're filming or just on the phones or I don't know.
Crowding around.
And so I started to do CPR and obviously got someone to ring 999. And by the time the paramedics came and taking the gentleman away, I mean, sadly... He died, but I did my best. That's what you can do.
How did you know he died?
Because I had some contact. I mean, he didn't look good at the time, but I think.
Well, no, he was already dead. But
I think there was some process of. I can't remember. This about 9 years. It was some kind of process of. Finding. I can't remember. Or did I have to do a report on it after? Or there was some. I can't exactly remember.
I feel like now you wouldn't know. They'd be whisked off, and that would be the end of it.
I mean,
never know.
I didn't have a nurse's uniform on at the time. I wasn't aware, but I did tell them that I was a kind of nurse. So maybe I can't really remember. Yeah, you're probably right. But anyway, so all this had happened, and then I looked down and I had this big bag of CDs, and some fucker had nicked all my CDs. I mean, that's.
It's just that is humanity, isn't it?
Fucking hell. Yeah. Anyway. Anyway, I digress, but.
I can't see anyone's ever nicked my CDs on the ward while doing CPR.
No.
But
terrible. General public. Thatcher's Britain.
I have no words. That is shite. For Hogel, the thrill of grabbing the defib to make a dying patient's heart beat again was described by him actually in court as a kick. And when he succeeded in appearing calmly to save a person's life, it was like standing on a pedestal.
Was it like that for you in your career when you've
Absolutely not. Oh my God.
I mean, I'm joking.
I mean, I've never saved anyone, so maybe that's why.
You did your best.
But you never felt like a hero.
No. I mean, I'm joking.
Oh my God, it's scary though, isn't it?
Yeah, it is.
Like the adrenaline that you get from it, though. I mean, all I can remember really is my hands just shaking. Once you get into it, I think.
Yeah.
You tend to think really clearly of what needs to happen. I know that's my own experience.
Yeah.
But it is really nerve-wracking, and afterwards you feel so exhausted because it's been such a rush. But I never felt like, that was a fabulous experience, because it's not.
I mean, I was
joking. An awful thing to have to be involved in.
Absolutely.
So in the first hospital he worked in, his colleagues even made him a necklace, and this necklace was made of catheters.
What?
I know. Well, I guess they just used whatever they could find.
Okay. So they thought he was a good fella then, presumably.
I think so. I think it was a bit of a running joke.
And he was loving it, wasn't he?
Like being like...
He's always there when this person... Yeah.
And he's like this cardiac arrest champion.
Yeah. Resuscitation Rambo, wasn't it? That's what it's called, yeah. Resuscitation Rachel.
So Hogel even asked 2 female student nurses to come and watch him, clearly trying to impress them during one resuscitation attempt.
Yeah, I mean, that's,
just like...
What, did he just stop and say... Come, surely,
It's just like... It's embarrassing, actually.
Well, yeah, bit odd.
Ugh, he just sounds like a bit of a dope. Hogel quickly made a name for himself as someone who could handle the pressure of life and death situations. It appears Hogel was unsurprisingly not motivated by compassion. Some of his victims were conscious when he made his move, and in court he did describe one patient as a whale. And in a later trial he stated that he thought the hyper-detached attitude of some of his superiors was cool.
Hogel's killing spree was stopped in 2005 when a nurse, Renate T, caught him in the act of administering unprescribed medication to a lung cancer patient named Dieter Meers.
That's a German name, isn't it? Dieter!
Oh, yeah. Life support system had been switched off, and in the rubbish lay... Rachel's put trash, but, you know... In the rubbish lay 4 empty vials of medication not prescribed for that particular patient. She quickly took a blood sample and sent it to the lab for tests. The next day, the patient was dead. When the test results showed a dangerously high level of heart medication, the doctor and nurse in charge met to discuss the situation. But they let Hogel finish his shift. Well, you know, short staffing. In those hours, Renate Roper, 67, became Hogel's final victim.
So basically...
No, that's
her name.
Well,
I can't,
what? She's the nurse.
help that the nurse and the patient has the same
okay.
name.
Sorry about that, yeah.
It looks like between the hours of him killing that patient, Dieter, and them kind of, you know, waiting for the blood test to come back, he actually ended up killing another patient, that 67-year-old lady.
Yeah, I mean... I don't know if, you know, I was, like, at this point, he's worked at several different...
He's worked at 2 different hospitals.
Yeah, you'd think that, I don't know, did people not talk to each other? But again, you know, I suppose, that, you know, he got that really good reference, didn't he? And he just, Resuscitation Rambo and all this.
You know, I read some interesting articles about, it was more the political side of why particularly in Germany people don't like to question other people. The culture does tend to be that people don't like to question other people. They don't like to make them uncomfortable.
So when police questioned him for the first time in 2005, Hogel proudly exclaimed during court that they didn't even ask him if he was drunk, despite Hogel stating that the whole room stank of booze. So it's quite sort of
that
open.
sounds really narcissistic, though. As in, like, I was there and I was drunk, and they didn't even realise I was drunk.
Well, yeah. Well, we'll come on to the.
It sounds like a twat.
Yeah. So, as of June 2019, Hogel has been involved in 3 separate trials for his killing spree. Hogel confessed to 55 murders, and the court in Oldenburg convicted him of 85 in total. It is possible that Hogel has murdered many, many more. Authorities have since investigated hundreds more, which included exhuming the bodies of former patients in clinics where Hogel has worked previously. However, the number of victims may be even higher. During the 3-year investigation, more than 200 cases were re-evaluated. The 134 exhumed bodies were distributed across 67 different cemeteries. In many cases, decomposition had progressed too far to be able to detect any traces of medication. 101 patients from Delmenhorst, who died during Hogel's tenure, could not be autopsied as the remains had been cremated. In 2015, suspected victims were exhumed in Ganderkers and Delmenhorst. The body's autopsies revealed traces of heart medication. I mean, I guess they would reveal traces of heart medication if they're on that, but I guess it depends to what level, doesn't it?
Yeah, I mean, that's just really difficult to draw any conclusions from that. I'm not sure any of that
it's indicative of
nothing, kind of, in a way, though. I mean, I don't think any of that information
possibly
would be able to be brought to court.
No. Well, we don't know the levels of heart medication, do we?
But basically, it indicates God only knows how many people he actually killed.
Yeah, that's it.
I mean, he was working as a nurse for like so many years, but on that killing spree for like 5 years.
I mean, it reminds me of, several true crime podcasts have covered this, and there's been books and documentaries. Beverly Allen?
Yeah, I mean, classic
It's Grantham
case.
Hospital, wasn't it? I think that was early 90s. And I know...
There's been loads of different cases. There's been quite a few in Germany as well.
I'd never actually heard of this one, which obviously is one of the reasons why I'm doing it. But yeah.
Yeah, there's a lot of cases out there that mirror the same type of person doing that type of thing. It's quite interesting.
I mean, I think sometimes we forget, me and Rachel are both nurses, that we're in a very privileged position, because we do it every day. You kind of just, you get into the, you go to work, you come home, but we're in a very privileged position, and and a very, you know, a position of trust. I mean, we've got access to, you know,
a wide range of different medications.
Absolutely, and you know,
and potentially, I mean, thankfully, most nurses are good people who don't want to cause any harm.
Well, yeah.
But the potential is there that actually, you know, you could really do whatever you wanted to if you wanted to do that.
Yeah, I mean, it's...
So I guess that comes into the factor of why is there so many nurse killers, is actually they have it's the means to do it.
Yeah, there's the means, but when we say there's so many, well, if you... As a percentage-wise of how many nurse killers, let's say, they are compared to how many nurses they are, then it would probably be very low, you know.
Yeah.
But it, you know, but yeah, it's the means, isn't it? And the position of trust, and responsibility.
Yeah, definitely. So why did Hogel do it? Dr. Carl, I can't stop laughing at
Paul
this
Heinz
name.
Bean, yeah.
Heinz Bean, and I swear that is the name. I did not make that up.
Made that up. What?
I can't go on calling him that.
Just us.
I'm just going to call him Dr. Carl.
Dr. Bean.
So Dr. Carl, a leading German neurologist and head of psychiatry at St. Marian Hospital in Hamm, pointed to Hogel being motivated by a narcissism and a deep need to fill a lack of self-worth. In quotes, he says, Neils Hogel is a member of an extreme minority, but what struck him about his testimony was his lack of empathy, even when speaking to victims' families. However, there are differing opinions. Another psychiatrist, who was actually an expert witness, said during the trial that while Hogel had displayed traits of noticeable personality disorder, such as that lack of shame, guilt, lack of empathy, they were not so severe as to nullify his responsibility. So in other words, whilst Hogel has been diagnosed with narcissistic personality disorder, it does not mean that he lacked competency and awareness surrounding the gravity of what he has done.
That's interesting, really, because I know in the areas that we work, assessing somebody's competency or capacity has been a real big drive. You know, quite rightly so. Probably over the last 5, 6, 7 years, and we assess somebody's capacity on admission to hospital, don't we?
In relation to literally any
decision
that's made.
So
it could be, you know, admission to hospital. It could be in regards to medication. It could be in regards to going on to a placement. There's literally it is every single decision, and it's decision specific.
And there was an incident once. I know this has happened to a lot of mental health nurses and nurses generally, sadly, but I know. You know, I've been assaulted a couple of times at work, and there was one occasion, well, on both occasions, it's kind of, okay, they may have had a significant mental health diagnosis.
Yeah.
But that doesn't necessarily mean they haven't got the capacity to understand
what they're doing.
Well, they're still responsible for their actions.
Yeah.
That varies, of course, and it's assessed on an individual basis.
Yeah, and it's only applicable to that time as well.
Of course, yeah.
Because it can fluctuate, it
Absolutely.
can change.
Absolutely.
But